Service page. I'm your host, Enrique Hasso, the Associate Director of the Texas Health Education Service. We are very excited to bring you one of the new kids on the block here at TMDSAS, the University of Houston College of Medicine. We've got two really awesome guests joining us today. Dr. Dayton, would you mind introducing yourself first, and then Dr. Horn?
Hi, I'm Dr. Dayton. I am Director of Admissions, and so anyone who is in the application process has probably been getting emails from me or will be getting a lot of emails from me. And welcome, everybody. Thank you for letting us be here.
So I am Kathryn Horn, Associate Dean for Student Affairs, Admissions, and Outreach at the University of Houston College of Medicine, and happy to join you all today on this Courage session.
Great. Thank you so much, and I appreciate your flexible working with us with technology issues. So we just asked the first question, the University of Houston system, this is the first medical school as part of that system. So how does that influence the role of the existence of the admissions committee? How does the mission and the vision of the University of Houston system influence the admissions process?
So I have to say that the mission influences everything that we do. And so the first part of our mission statement says that we educate a diverse group of physicians who will provide compassionate care and high value care, and that we're primarily looking at people who are interested in primary care and other needed physician specialties. So our school was founded because we recognize that Texas, as well as many parts of the country, but particularly Texas, has a great need for more primary care physicians. And so we were, when we were founded, our dean, Dr. Spann, and the president chancellor, Dr. Couture, knew that Texas needs more primary care doctors and people who are committed to caring for those underserved populations. Now, we have in Texas a large number, but in Houston, even though it is where we have one of the world's biggest medical centers, we have a large number of underserved population. And right around our particular campus, we have Third Ward and East End that are two neighborhoods that don't have enough physicians, and people have been traditionally without health care. We're seeing that particularly with COVID-19, and you can see many of our community members who are impacted more heavily than other parts of the city. So that is all part of our mission. And so the admissions committee really looked at that and said, how do we address the mission? So as we talk today, we're going to share about how we are interested in finding people, students, applicants who are committed to our same mission. And so that is something that we take seriously, and our whole day of interview, as well as our process of selecting who gets interviewed, is around that mission and who is consistent with our mission. So we can talk more about that too.
And I will add that being part of the University of Houston system, University of Houston has a spectacular record of innovation. It is unafraid to try new things. And so I have, my backdrop is its food delivery service. I like to call them the little Wallies. But University of Houston will try something. And if it doesn't work, it will figure out what to try different. So that we are also looking for people who have that mindset, this big think of looking around, taking in the information, what's missing, what can we improve, how can we step up to what's needed. And so we very much have that innovative mindset in everything we're doing.
Excellent. I appreciate you explaining the Wallies back behind. I think that's wonderful. That level of innovation. As we've spoken to some of the other schools, it's definitely the direction that medicine seems to be taking right now is, implementing interdisciplinary, career paths and opportunities for medical students. And of course, we'll get into this a little bit further down in this Courage session. So since this is a new school, would you mind walking us through the curriculum of what students can expect at University of Houston?
Sure. So we start off with an 18-month preclinical phase. So we have three phases: the preclinical, clinical, and advanced clinical. So in the preclinical, there are basically four courses. But if I could say, so we start off with some foundational. So anatomy and scientific foundations of medicine is in the first semester. And then the second semester, we go to organ-based systems. But across the whole year, the students also have a course called Physicians, Patients, and Population, where they learn about such things as clinical skills, epidemiology, the social determinants of health and how that impacts our patients and the communities around us. And then we have a course called Longitudinal Primary Care. And within that course, the students are assigned every week to be with the same preceptor every week for the whole year, and probably, I mean, if possible, stay with that same preceptor for 4 years. That we know people move, but that's the plan. 4 years of every year there will be longitudinal primary care. And then once a month, as part of longitudinal primary care, the students work in an interprofessional group for household-centered care, where they are caring for members in the community, a household that's been identified. And it is not about giving them health care. It might be connecting them to health care, but it's being a resource to address those things that inhibit their ability to have the best health and health care. So that will be with our students, social work, nursing, and different other professional schools will interact with us as well. So that is a unique feature, which we can talk about a little bit later. And then we have 5 sessions that are week-long kind of intersessions called clinical focus sessions, where we look at specific societal needs that we are focusing on. And it gives the students a chance to work together in groups to have a deep dive on those areas. Like we started off with our community, and so they get a better understanding of where we are serving right here in the 3rd Ward and East End. So that's the pre-clerkship phase. And then in the clinical phase, the students will spend 24 weeks in an ambulatory setting, longitudinal integrated clerkship, where in that 24 weeks, you are moving between 6 different specialties over time. So it's mainly ambulatory, but you will work with, say, in a group of different physicians. So you may spend half a day in family medicine in the morning, and then go be with the internal medicine in the afternoon, surgery the next morning, psychiatry, OB-GYN, and pediatrics. And so this is every week you have experience with each of these different preceptors. And then there are blocks of inpatient, internal medicine, surgery, OB-GYN, and pediatrics as well during that time. At the end of the clinical phase, our students will take step 1. So the first class will take step 1 in after January of 2022, when it is a pass-fail test. We had actually already made that decision before the test was moved to pass-fail, because we feel like students can integrate their knowledge better when they have their pre-clerkship phase, then can apply it to their patients, and then take the test. So it is a little bit different in that regard. And then we move into advanced clerkship phase, and that is for inpatient, you have sub-I, so you're acting intern, ICU, emergency medicine, and a month of rural medicine, and then 6 months of elective time. So those will be over that advanced clerkship phase. So our students will be our main affiliate is HCA in Houston, which are 5 hospitals across the community. We also have an affiliation with St. Joseph's and MD Anderson. So our students are not in the medical center, they're in the community hospitals because we are caring for the community. And in their longitudinal primary care, they are in community facilities. So those could be federally qualified health centers, FQHC, which we have one in our building where our school is located and our faculty practice. So some students are with us and others are throughout the community at other federally qualified health centers, or some are with private community physicians spread out through the city. And so it is a community-based medical school, and which is a little different than being located in just 1 or 2 hospitals. So that is a little bit different as well.
Thank you so much for that. And we went ahead and shared a link to the curriculum available on the website so that folks could follow along. And you hit each one of those points, right?
Okay, good.
Exactly right. So thank you very much for walking us through that. And for those of you listening to this on the podcast or watching it on our YouTube channel, you can check the description for a link so you can also follow along with the curriculum discussion. So, you've mentioned that, it's almost like a decentralized plan in terms of community engagement and participation in clerkships. But other than that, are there any other opportunities that are unique to the school, or maybe even because of that, opportunities that are unique for students in that school?
Well, I think that one of the opportunities is with research. All students, as part of their physicians, patient, and population course, are expected to do a research project. and that's up to them what they would like to pursue. But there are a lot of projects going on that are related to interprofessional and interdisciplinary research, and a lot about delivering healthcare. So we do have the Humana Integrated Health Systems Science Institute at the University of Houston. I always have to look at it because it's long, but it is. So University of Houston is partnered with Humana, which is an insurance company, to look at how to do, how to provide care better. And so this is actually not just with the College of Medicine, but it's with College of Nursing, College of Social Work. I want to say engineering, but I believe they have 4 chairs that they are working with, or 4 endowed chairs in 4 areas, but that students are part of that and can participate in that. And Humana brings things to our campus for students to understand as well. So I think that is a unique opportunity, and the research that will come out of that will be different. And students can be part of the cutting edge of thinking about how do we do healthcare differently. We know there's lots of problems in our country and everybody wants to have a solution, but we have to start working on those. And so we have people working on that within the College of Medicine, as well as many other colleges at UH. And that innovation that Dr. Dayton talked about, I think we see that here. It's not often that you see a academic center aligned with a insurance company. So, and they've been working on a lot of great things. So I think that's something that's very unique. And then of course, the household-centered care. Everybody wants to do interprofessional education, and it is difficult because everybody's got a different timeline on their education. And so to do household-centered care, which will be throughout the 4 years, you will really get a feel of what's happening in the community. And so that when you get out of medical school and you go to residency and then practice, we want you to take that experience of how do I engage with the community. It's not just you and your office and you and your patients that come to you, it's the impact you can have on the community towards overall wellness. And so whatever specialty you ultimately choose, we think that's very important.
Excellent. Thank you so much. So we've gotten quite a few comments already, the typical go Cougs, as are to be expected whenever we have University of Houston. But we do have a few questions, and I think they're a great segue into discussing the admissions process into University of Houston. So first off, we wanted to ask, there have been a lot of great articles coming out about the first class. It's no secret that the first class had a really generous endowment that allows them to have a pretty unique opportunity in terms of financial aid. So could you give us a kind of a glimpse into this first class, anything that you can provide in terms of a profile for how they shaped up?
So I will jump in here. So our first class is 30 students, as everybody, or as many people might know. We were coming in at an odd time in the application cycle, so we didn't know what to expect. And that ended up being something that has, I think, been great for us because it made it where people, members of our class who had other offers, they really want to be with us. They were able to get to know us and ask all the questions that, we get such great questions throughout the admission cycle. And they really got to understand if they clicked with where we are going. And so in almost every way, the composition of our class is a byproduct of the mission. Our admissions process doesn't look at race. It doesn't look at our admissions committee. They don't discuss MCAT. They don't discuss GPA. They are talking about what has an applicant done? How are they aligning with where we are going? What insights do they have? How will they be moving our goals forward? And so we landed in such a great place because we have, we got people who had a wealth of experiences and many ideas and such strong connections to the patient population. And so the profile of our first class shows that these are the people who really got it. And we are so thrilled that they have joined us because I think it's going to be a spectacular outcome. We're hoping that we can continue this. I think we look forward to every single class being unique, but all of them being connected by this mission. So we have, some rough stats. 2/3 of our applicants, or 2/3 of our first class are from this Gulf Coast region. So I think 1/3 of them are from Harris County or Houston, and then another third are from right around Harris County, but all Gulf Coast regions. So they identify with this area, with this population. 100% are from Texas. So a couple of them were not born in Texas, but they have become Texans over time. And so they bring that with them. We have people from different careers in their backgrounds, come in from previous careers teaching or following, I think, seminary school. So lots and lots of different viewpoints that are expressed. And so I can't even give a common thread because every applicant, every person in our class actually is pretty different from every other person in our class. So it's hard to bring a batch of, we've got this many biochem majors or this many biology majors, this many chemistry majors. It's hard to give that breakdown because there's so much difference in our group. Dr. Horn, do you want to add anything on top of that?
No, I think that's right. And I think we have a mix of traditional and non-traditional students. So they're not all non-traditional and they're not all traditional. And so it is a mix. So some have advanced degrees and some are coming right from college. So it is a good mix in that regard.
It's holistic review, right in action.
Mm-hmm.
Yeah.
Yes.
Thank you very much for sharing that. We do have a quick follow-up question. Somebody's asking if the class size will actually increase over time or if it's going to stay at 30 for the foreseeable future.
So that is the plan with new medical school. You start off very conservative with the number of students. So we are recruiting for our second class of 30 students. And so we are not increasing for this next year, but after that, we'll have 2 years when we recruit for 60 students in the incoming class. And then our fifth cycle, we are recruiting for our full class size of 120.
Great. Now, I know that we just talked about how the admissions committee was almost blind to MCAT in their considerations, but there have been a lot of questions, particularly in our online communities. Is there a cutoff on MCAT scores?
There's actually not. And this is an answer that tends to make people a little frustrated when they call us or email us. And I understand and I sympathize, but what we are looking at, national data showing what combinations and what academic trajectories let us know that there's a high probability of success. And so there are some fairly complex tables and bits of information that the AAMC makes available to the admissions community. And so we are looking at every applicant, where are they falling? And so everyone that has a high probability of success moves into the secondary application phase, or they're invited to go into the secondary application phase. At that point, GPA, MCAT don't come up again. And everything is about match to the mission and what the applicant says about their experiences and what their vision is for their career.
Perfect. Another one of the questions that came up, the MSAR has the latest MCAT date considered as September 1st. But with the MCAT test dates being extended this year, some applicants wanted to verify that the latest test date this year, which is September 28th, would still be accepted.
Yes, that is some data that is actually not correct, and I just made a note to myself to have that fixed. So it's the last testing date for the year we will accept. So the last one in September, the 28th.
Perfect. So what can an applicant expect out of the secondary application? For right now, we have several thousand applicants that have come through and have started being transmitted to you. So when can an applicant expect a secondary application, and what does that look like for them?
Our secondary is, we're hoping not too arduous. We did not develop it to be a big task for the applicant. So it is something that has a little bit of a grid at the top or a checklist at the top for the applicant to say if they've certain kinds of experiences, and if we give them a chance to tell us if they had any kind of pre-medical advising or mentoring. And we have a question that just lets them say if there's something that's not already reflected in TMDSAS, like a time obligation that impacted their pre-medical career, that they want to tell us about. And then it's two not very large questions. related to their mission fit. One of the biggest questions I have gotten is, when you say a 500 character limit, you mean 500 words, right? No, we meant 500 characters. We are looking for just a succinct, concise explanation here, because we have the rest of the application as well. So we don't want someone to have to write another 2-page essay here. It was not designed to be cumbersome in any way. Applicants are screened for secondary almost daily. And so if there are delays, it's most likely from MCAT score transmission. We are waiting to see the MCAT score before we do extend that invitation to a secondary. And so if you submitted to TMDSAS and you say if your application's been verified already and you're still waiting and you don't know what's happened, it could be that we're waiting for your MCAT score.
Yeah, and once MCAT scores are released to TMDSAS, it takes typically around 36 hours for them to appear on your application, and then of course the application processing times are listed on the homepage. I'm sorry, Dr. Horn, you were going to say something.
I just was going to say is that we opted not to send a secondary to everyone. So we are sending the secondary to those who fall into the range that we expect them to be successful in medical school, and then you'll see the secondary. And so I just wanted to make that clear. And that it is that we ask you to reflect on that secondary of your activities that you've already done and said in your application. So, which we just wanted you to be able to highlight what you think shows that you meet our mission. And so it is more than what you say, and people write beautiful essays, and I appreciate that, but we also want to see some connection to what your life experiences have been, so that we can see that you fit our mission. And so it is, so I think looking when you're, hopefully there are people out there who've not yet applied, so we're thinking future years, that you look at our website, you look at our mission, and you say, that's what I really want to do, then you're showing us and you're involved in activities that connect in that same way, and you're able to reflect on that. So I think that is one of the critical things we're looking for, is that we know that there are so many qualified applicants and they are going to be great physicians. But our curriculum is very much geared towards helping people be involved in primary care. And if you know that you don't want to do primary care, then this probably won't be your fit, because you will have to be in primary care clinics throughout the 4 years. You will be doing a lot of that in the longitudinal integrated clerkship. It's ambulatory, and you're not in a tertiary care center. So we are preparing people to be in primary care settings. So I think those are things to consider. And I know everybody wants to get into medical school, but there is a medical school that will fit you, and you should consider that as well.
Wonderful, thank you. So what does your interview season look like? When does it typically start? And maybe when does it start this year? And till when are you planning on interviewing?
I have to say, I look forward to the days we can say what a typical interview season is. Because, this is our second interview season, and it is our first one that is actually occurring with the timing of TMDSAS. But like everyone else in the nation this year, it will all be virtual. And so applicants will, when they are invited, they'll receive their invitation. They'll be able to log in and select their dates. We'll make their available dates shown. We will have response emails that give some tips and pointers to confirm their date. And then it will be hosted through Zoom. So the interviews will be hosted through Zoom, but we have contracted to have the AMP system coordinate all of the interviews this year. So we're not doing it manually like we had to last year, when at the same time the entire world learned Zoom exists. We were learning how to make Zoom do virtual MMIs. So we're grateful this year that background logistical piece will be handled by a software platform, and will just let us engage with the students and not have so much troubleshooting that our office staff have to do for them. And so we think that will make this year much smoother than last cycle, and we're looking forward to that. We do MMIs, and we do not have a traditional type interview interaction, so it is all MMI. We have, when somebody first begins their interview day, we'll have an introductory session, which will be just with me, And I will greet everyone, make sure they know what the day will look like for them, take the time needed to do any technical troubleshooting to make sure everybody can do what they need to do on their end and that all the audio is good. And then we will go into the MMIs. Once the MMI sessions are complete, everyone will join for some more informational sessions and be able to hear from individuals within our College of Medicine.
I wanted to jump in really quickly too and to reassure applicants that the good thing is we've already done virtual MMIs and we did virtual interviews. I mean, basically our whole interview season in 20 was virtual. And so we've already learned sometimes things happen. So reassuring people that if you have a technical difficulty, it's not going to impact your interview. We have a way to circle back, make sure you get that opportunity. And if it's a total washout, we'll give you another day. So we don't want anybody to feel threatened by what's happening in the technological field. You all are probably much more adept at it than we are, but I think it will run very smoothly and actually was not an issue during this last year. And we were able to accommodate everyone, anyone who had difficulties, whether it was on our side or student side. So I think that the way Dr. Dayton set it up was perfect so that students really got heard and we didn't leave anybody on the wayside.
Excellent. In next week's Courage session, I'll actually be taking your questions on virtual interviews, preparing. We've met with each one of the schools. We've met with all the deans for the dental, medical, and veterinary schools on best practices and what you all should be doing to prepare. So we'll be sharing those next week in the Courage session. We've got a few follow-up questions that I want to make sure we get to. And I think these are all still on the subject of the admissions process. Of the 30 students who made it, are any of them not focused on primary care or looking to specialize in something else?
So I would say that all 30 of those, I think we looked at like there's a 93% fit with our mission. So that's pretty much everybody. So we don't make you sign on the dotted line that you're going to do primary care. And we realize people can change in the experiences of medical school. But I think that there are people who, if the committee felt like they didn't really understand what primary care was, that they might not be a good fit. And so when we're talking about primary care, we're talking about family medicine, internal medicine, and pediatrics. And so those are the areas that we're most looking for and evidence that people have been involved in clinical activities or their own personal experiences that have informed them. And that could be in a rural area. It could be inner city, which is where, underserved inner city, those that haven't had access to healthcare. It could be in suburban, but it's a matter of understanding what primary care is about. So I won't know if everybody's going to do primary care until we get to the end. And I would say that's probably not going to happen 100%. But we do know that the literature is pretty clear that if that's your area, if you start off that way, that where you're more likely to continue that way, as opposed to trying to have somebody who's never considered primary care to then choose that in the midst of medical school. Because a lot of people say that they might be interested and then they may not have known all the other opportunities. And people choose primary care because they enjoy interacting with patients over time. Our dean likes to talk about the importance of relationship as you heal through relationship. And our students read the book or are reading the book called Compassionomics to talk about how compassion impacts their ability to serve people. And we want them to hold on to their compassion and not to lose that in the midst of their 4 years. So that's kind of going into the next part about student services, but we consider wellness is really critical, that if you're burned out, it's really hard to care about your patients. And so we try to pay attention to that throughout the 4 years. And it's a challenge for physicians. It's a challenge for medical students and graduate medical education, so that we try to be aware. I'm not going to tell you that we will do it perfectly because we're all a community. We do things well and then we make mistakes and we learn and we go forward. But we want to be aware of that. So I think those are all things that starting to focus on early on. If we can keep you healthy, engaged, and excited about your caring for other patients, then hopefully you will hold on to those things that you value in medicine.
Thank you for that. We have another question here. If someone has a low GPA because of classes taken 15 years prior, is there a way for them, assuming admissions committees, to see that?
Of course there is. So we see the class trajectory. We see the list of courses. We see if somebody's had stumbled and if somebody's corrected. So one thing our committee is really, really good at doing is looking at where you are right now. There in no way is someone who had courses 15 years ago, even if those courses were perfect, they are not the same person they were 15 years ago. And so our committee looks at where are they now? Are they ready now? And that's actually one of the best gifts that I can give to any prospective student is the gift of time. Are you ready now? And if not, there's time to become ready. And so don't think that you have got to apply the very first possible moment. And if you don't apply at that first possible moment, it'll never happen, because that's just not how it works. That's not how it works. Give yourself the gift of time so that when you apply, you've earned the right to feel confident. You've been working so hard for so many years. You've earned the right to feel good and confident when you finally decide now is the time. And so when you feel that way, your application shines. It really does, because you know what you've got to offer. And our committee sees what you've got to offer. And so we're great at that. So yeah, if you have stumbles academically, did you make a correction? Can you talk about what you did? A lot of people worry, oh no, I started school, I was a freshman, I did those things that freshmen do, and now my GPA took a hit. No one will ever let me into medical school. There's this big secret that medical doctors are people too. They also were freshmen. They know what they did. They know what their own children did. So if there's something where you feel like there's a weakness in your application, have you shown where you've made a correction? Have you shown that now you've got this? Are you able to speak about what you did? Because if just you messed up and you can't really say what happened and you're not really sure what you did, but it's okay now, they're a little bit less certain about that. You have to be able to say, I made choices, I made decisions, I saw the impact of my decisions, and here's how I know I've got something to offer the medical field. And here's how I know I've got something to offer as a medical student. And I am inviting you to learn more about all these great things I've got to offer.
I'm gonna put that on a t-shirt. All right, another question. This one's from a pre-health advisor. Hello, Shirley Anderson from UT Dallas. Students are scrambling to make sure that they're prepared for potential interviews from their home. Are the committee members that are interviewing attempting to remove the bias of seeing somebody's background or environment?
Absolutely. I think it might have even been the last TMDSAS advisory council where I learned the fabulous phrase, we're all learning to give each other grace during these times. That is true. I mean, all of us understand the struggle, and all of us are learning where biases could possibly creep in that we don't want those to impact us. So yeah, we've had formal training on that with our committee, and these discussions are ongoing. And so you, please, as an applicant, do not ever think that the technology is going to, that something associated with having to do virtual interviews in the technology will work against you. So just feel confident they're hearing what you say. And the biggest worry is if the tech and internet connections are just not working for you that day, that's okay. You can say, I need a different day because technology is not working today. We're prepared for that, and we understand.
And from what we heard from that meeting, all of the schools understand that at TMDSAS. So thank you very much for that. Yet another question here. When can we expect to get invites for secondary applications? So have those started going out?
They have not. The screening is very active and underway, and I expect to be issuing the first round of invitations on behalf of the committee beginning this week.
Great.
So I'm sorry, Enrique, did you say secondary or interviews?
Secondary.
Oh, sorry. Apologies, I entered for interviews. Secondary invitations have been out since July, and they are happening on a daily basis. So I go in every day or almost every day to issue more. And so if you haven't made sure to check your spam filters, check your spam filters. That can be an issue for some mail servers more than others. But it is ongoing and will continue to be ongoing. And then interview invites, we are expecting to start issuing those very soon.
Yeah. And just as you mentioned, interview invites have been going out since July. I pulled up the TMDSAS processing times. They are processing applications submitted on July 13th right now. And so it takes a while to get applications processed. This is the high time of the application cycle. Of course, the schools all recognize this and have made appropriate adjustments. So just because secondary application invitations have started going out, or interview invitations will start going out in the next weeks, doesn't mean that this is the end. There's plenty of time in this cycle. So please be patient with the process.
Yeah, I mean, everybody, I mean, from what I have heard, every medical school is adjusting their timing and making sure that the distribution of all of the invitations will be fair. So nobody's rushing to make sure everything's done right away. Everybody's giving time for this.
Yeah. And that was the whole purpose with, pushing back the application deadline, and of course, pushing back all of the TMDSAS match deadlines. The TMDSAS match this year is almost 5 weeks later than it was this past year. So that allows the schools much more time to be flexible. So, there's plenty for our applicants to do in the meantime as they're going through and waiting for processing. Another question that we have here: if we have updates relevant to the University of Houston mission in our application, are those things that they can email to the admissions department or just wait until the interviews?
So our policy is that we look at the verified activities and application from TMDSAS. So we don't add updates by an email system. If something has come in that you really want us to know about, if you're a strong mission fit, you'll be able to tell us at your interview. But if you're waiting for just one thing, one more thing, one more publication, one more thing, the application is a culmination of so many years of work. One more thing's not make or break it for, I'm going to go out on a limb, for any medical school. So we've got the whole picture. That one more thing should be adding into all of the other great things we already see. So it's not going to make or break it. And so please don't worry too much about that. We see the whole picture. We see all the work you've done. So that one last thing is nice, and you can tell us about it at a later time.
Very well said. Thank you. So do you have any advice for applicants who really, really want to attend University of Houston?
Well, I think asking yourself, why do you want to attend the University of Houston? And so if you're an alum of University of Houston and you're excited about our College of Medicine, which I have had many people, and that they're so excited that University of Houston has made this commitment, I think that is great, but I think you also have to be in alignment with what our mission is. So I think it's figuring out, how do you tell us that you are? And we look at two things. We look at the secondary application, but we look at the primary application too. So that if you are very interested in primary care, then I expect you're going to say it, or you're committed to underserved, community health, public health, that I'm going to see that in your primary application. So I know students want to have a wide opportunity to interview at all of the schools. I can't think of any school that is going to turn you away if you talk about primary care. So if that is your passion, then you should put that. And if we don't see it, then that makes it difficult for us to see that you're connected to us. Now, we say primary care and that you're committed to the underserved populations. So I think sometimes it's a stretch, and I want to be able to see where your connection is. So I think that if you really want to come to UH, that you look at our website, which is finally much more developed, I'm thankful to say, so you can see a lot of what we're doing. You can see what our faculty are doing, what's important to us, and see if you align. And I think that our committee is pretty good at finding out, or discerning if somebody is really shows evidence versus they can talk a good game. And so I know that is what you got to talk a good game, and I get that. But we're not saying this because we want to punish anyone. We just want you to be happy in these 4 years. And when people pick schools that they're not don't have that same alignment, it makes it harder. And medical school is hard enough without adding that of trying to fit someplace that you may not be comfortable. So I would just say, examine your heart. If this is the place for you, you'll know it, and we will figure it out as well. So now we have so many amazing applicants, and we only get to have 30 students. And so hold on, because as Dr. Dayton said, coming up, we'll have more students, and so there will be more opportunities. But that's where we are right now.
Thank you. So I want to shift gears now that we all know all the ins and outs of how to get into University of Houston to talk more about the student experience there. So obviously, you're just a stone's throw away from the largest medical center in the world. What does that mean for your students?
Interesting is that it probably doesn't mean a lot to be right there, except for good places to live and eat, and so living in places where other medical students are. But by design, our students are in the community, at the FQHCs, at the HCA hospitals across our region. So students in fourth year of any medical school, you have options for electives. And so if you wanted to do an elective at UT McGovern or Baylor, we will walk you through that, or UTMB in Galveston. But other than MD Anderson at this moment would be the only hospital that's in the medical center where we currently have an affiliation. And I don't think that'll change because there are other opportunities. So that fits with the way we are planning to do our curriculum are the community hospitals. So I think that it is a really unique thing about Houston, though, that you get to see that we have this amazing medical center, and then we have whole swaths of people that are underserved or are not served at all. And I said this earlier, but COVID-19 has definitely shown that to us, that people across our city are so ill, and it's the underrepresented groups that underrepresented in healthcare. Those are the ones that are suffering. So we're there, and we want to help our underrepresented populations.
So could you give us a glimpse into how classes have been adjusted due to COVID-19?
Sure. So it's been a moving target, as it is around the whole country, I know. Our students are, we started with, our orientation was virtual. We did very little in person. However, we did opt to have our white coat ceremony in person. If you go to our website, I think you can see the link. And it was just our class, but we were socially distanced, and it was a very special event for the students. And then they are doing most of their classroom is virtual. However, we have small groups in anatomy. For us, anatomy is in-person dissection, and that is continued. They just are in small groups and come in at staggered times. We still have clinical skills in person, again, smaller groups. And then the third part is longitudinal primary care. They are out in the community with their preceptor. They don't willingly see, let's see, the better way to say it, that we don't plan for them to see COVID patients. And I think this, again, is on all medical education. The recommendation is that students are not involved with COVID patients. Sometimes you don't know, and that's why you still use the standard precautions and make sure that you're using proper protective equipment, things like that. But so the biggest adjustment is that our curriculum, our goal was that we would have less than 20% of the interactions would be lecture. And so it has been quite a challenge for our faculty that they are rising to, that they are online, but it is interactive. So whether that is using Turning Point or interactive small groups, so we are doing that virtually. So, so far it's worked pretty well. I think the students feel connected. I won't say it's easy. It is hard to come to a new medical school, a new phase of your life, and you don't get to be all in the same room. So lots of adjustments, but that will continue as long as we need to do that based on what's happening with the COVID pandemic.
Earlier, you alluded to wellness and some of the initiatives that you all have. Could you walk us through some of the student services that students can expect out of University of Houston?
Sure. So one thing that's many schools do this, but we do divide our students into learning communities. So there are 2 learning communities in the first class, and they each have their own faculty mentor that is their go-to person. They can talk about things. Each student also has a faculty advisor. So they have a couple of people they can reach out to and who are reaching back to them to make sure that they're connected, they know what they need to do, and just to be a support system for our students. We also have a director of academic support who meets with all of the students and gives them ideas on better ways to study. And we find that everybody benefits from that because we think we know how we're going to study for medical school based on what we did in college. And sometimes that's effective and many times it is not. And so we're aware of that and we try to stay in front of it and not get behind it. And then just being part of a big undergraduate campus, that there are so many things available. So we have psychological care. So our counseling and psychological services are available on the campus. They're currently available virtually, which is very convenient. And then student health is also separate from the medical school. And so students never have to worry about conflict of interest because their clinician is not going to be teaching them that they see in student health. And then an amazing recreation center, which is opening back as the students come back next week. And so with modifications like everything else with COVID, but there's a lot of opportunities. And then the nice thing about a new school is that the students will be building what student organizations they want. They will start the process of building their student government. None of that is really rolled out just yet because right now they're pretty focused on anatomy and first test coming up. So those are the things that we're working on, but the class will be very involved and in future classes as well. So in the first few years, you're laying the foundations and what are the traditions that will be part of the UH College of Medicine. So it's an exciting time to be part of our community.
The first few classes are trailblazers for the school. Yeah,
right.
That's great. We also discussed this a little bit earlier about interdisciplinary research. Would you mind kind of walking us through some more details on the opportunities that students have for maybe not just research, but just working with other disciplines? I mean, we've seen, I think it's been at the forefront that medicine is no longer just a doctor coming into a room. It's definitely a full team of specialists. So would you mind sharing how you prepare students for that environment?
Sure. I mean, a lot of this you can see on our website too, but so one is the household-centered care, which is the interprofessional team that look at social determinants of health. And I haven't said a lot of that right now, but what about that today? But what are all the other things that impact a patient in their quest for health? So is it food insecurity, transportation issues? I mean, we know that where you live can be a bigger predictor of how healthy you are than anything else, which is crazy. And Dr. Span, when he welcomes the students, talks about that in 2 different zip codes, there's like a 19-year difference of how long people live in Harris County. And that's really hard to believe, but the data is there. So being part of that interprofessional activity there will be other things that students will do as they get into the clinical phase where they will interact with nurses, social workers, also physical therapy, occupational therapy. So all of those things that you'll get a chance to be involved in. And then I think that understanding the things like Humana or others where you try to look at how we're going to change healthcare. So we have a lot of people in our school who are very focused on healthcare policy. What can we do differently? So if you have an interest in that, there are people that can mentor you, and that could be a great place for research, which is, so that could be interprofessional related to legal, and sometimes other things like bioengineering with medicine. And so I think it's kind of the sky's the limit of what you might like to do. there are other opportunities as well, that we do have a opportunity that you could get MPH or an MBA while you're at UH. Now, it is not a combined program. They're two separate. You would take a 1-year leave from the College of Medicine. It would be in a 5-year period. So between third and fourth year, that you would take a year and go and finish your MPH and then come back for fourth year, or do an MBA. And there's some overlap with some of the third and fourth year curriculum. But so those are for people who want to explore even further how interprofessional activities might help them to be a better clinician, a better provider of care in their future communities. So I think that, there are so many things that are happening on the University of Houston. When we got there, as I've been with the University of Houston a little over 2 years, and the amount of health-related research is a lot higher than you would have expected, but also looking at where all of the intersections, so the College of Social Work and what they're doing. So we are working with community health workers in our household-centered care, and community health workers were created through or trained through our honors college at UH. And so that was something that was there before we got there, but recognizing that community health workers, who are lay people interacting with people in the community to help them know what's available for healthcare, what a great resource. And so our students will work with those community health workers who are already out there, have an established track record. So there's a lot of exciting things happening that we're joining. We did not create. So a lot of synergy, which is great.
And surely those opportunities are bound to expand exponentially as time goes by. I mean, University of Houston is a really impressive campus with so many different colleges. So there are bound to be plenty of opportunities that show up as the school matures.
Absolutely.
All right, we have 2 more questions, and then we'll offer you an opportunity to address our applicant pool. But the first question was on how many students applied in this past year. We know that 30 were accepted, but would you happen to have a number off the top of your head on how many applied?
I think it was around 2,200 in TMDSAS, and somewhere between 1,700 and 1,800 secondaries that were screened for interview.
And it is worth noting that University of Houston this past year actually joined after the TMDSAS match, so that likely may have affected some of the numbers. So surely you're bound to see many more applicants, as we're seeing through TMDSAS this year. I think the latest numbers, we've got about 900 more applicants this year so far in comparison to what we had last year. Another question that we have here is, what would you say the experience of attending University of Houston is different from other schools that may be primary care or underserved care driven?
Well, I think our experience with household-centered care is different. I don't know that anybody else in Texas is doing that. And the longitudinal primary care, so I know that other schools do have early clinical involvement, which is really important. But once a week for 4 hours, I think is a little different. And so I think that the students are already enjoying that, because that is a preceptor that can also be a mentor to the student over many years. So I'd say that that's a little bit different as well. So I do think that we are paying attention to primary care throughout. And then the clinical focus sessions, which I didn't write down all of our topics, but things like death and dying and the quality gap and things that where we're going to go back and relook at those. What are the issues in society that we need to address? So I know those are all included. There are many things that include everybody's curriculum, but I like how we have these little 1-week sessions so you can stop and just focus on that. Sometimes when you're trying to do the organ systems, and then we ask you to also focus on the communication, things like that, it's like too much. So to have this whole 1 week of just being able to look at one societal problem and how you can have an impact, I think is a unique portion as well. So, and then the longitudinal integrated clerkship, where our whole class will go through longitudinal integrated clerkship. And I know A&M has that as a portion of their class, and I'm not sure that anybody else is doing that yet, but others could go to that, so that you get to know somebody over time. Because one of the problems of having just the 6 weeks or 12 weeks or 8 weeks, is that it seems like, okay, everything, you just get that little view. And when you're seeing somebody with like congestive heart failure, I mean, what happens in the hospital is a culmination of everything that's been going on before. So if you could have known that patient for 6 months and watched them and say, wait, you're gaining 2 pounds, too much fluid, let's back off. You're able to keep them out of the hospital. That's what we want you to understand, because I think that it's hard to understand the value of primary care when you only see little snippets. But if you get to walk along with somebody in their chronic disease, then you get to understand how you can make a real impact and make a difference. And I think that's sometimes lost in other curricula. So that's something that I'm excited about.
That is very exciting. I believe TCOM has something similar. There's a student that I advised who went through that program, and it was really transformational for her in working with a geriatric patient, seeing and being a part of their life in helping them improve. So I can definitely vouch secondhand experience on how helpful that is for students.
Yes.
Now, as you all know, the courage sessions, they're based off of a quote from Winston Churchill: "Success is not final, failure is not fatal, it's the courage to continue that counts." So I'd like to offer you both the opportunity to address, current or future applicants who, this has been a scary year. There have been a lot of changes. Surely you all have seen your share of changes on your end. But what advice do you have for either current or future students looking to apply to University of Houston?
Dr. Horn, I'll go first just so you can finish it, if that's all right.
Okay, sure.
My advice for this year in particular is that we're rattled too. So that means we're very able to hear you. So please take heart in that, because it is the truth. And for applicants at any time ever, thank you for what you're doing, and thank you for your motivations and all the work you put into it. You have some place that will be a wonderful fit for you where you will thrive. There is one last step of courage you need to take, and that is committing to who you are, committing to what's going to be the right thing for you, because you cannot be equally amazing to every single medical school out there. When you're true to where you want to go, you're going to be exactly the right amount of amazing to the 5 or 6 schools that are right for you. And that means that you'll have a much higher success rate when you're able to commit to what is right for you and where you put your time. It will show. And so you don't have to be equally amazing to everyone. You've got to be true to yourself so that it shines and people really know where you're coming from.
Good. Thank you, Kate. But I would also say that, we recognize that there was a lot of chaos in the spring and summer. And so we asked people what experiences they've had, and you may not be able to shadow. And when I talked to TAP a couple of years ago, and we talked about, well, how do you get into more primary care shadowing? And right now it's a difficult thing to do. And so I think what I look for is, what have you done, and that shows you have a commitment to the people around you. And then you tell me how that impacts your trajectory in medicine. Because that means that you have reflected on it. So maybe you can only do something virtual. You're virtually tutoring a child, or, so you understand the stresses of that child, that family, and you broaden it and you reflect on it. So I think that is what I'm looking for, is not just in essays, particularly, of just a list of things you've done, but how you can reflect on that. Because that's what I want, is a reflective practitioner, because that's how you're going to be a good physician. And so I think being aware of that. And, I'm excited going forward. I think that things are going to change in how we do medical education, but also the interview process, that maybe this will move us a little further towards being aware of the stressors we put on applicants in the process of applying to medical school. So we are empathetic to that, and we want to be a support to you. And just, I think try and see what it is that you are passionate about. And so that means getting out there and interacting with people. Right now, that means doing that virtually, because I want you to stay safe. But there are opportunities. And I'm amazed at the things that students across the undergraduate platform has found so many ways to interact with their communities, which I'm really excited for. So there's lots of ways to show that you are committed to people, and that's what we want to know. And so I'm excited to see what you all will do with that. So thank you, Enrique, for letting us be here with you today.
100%. Thank you both so much for taking the time to address these questions and kind of reintroducing the University of Houston College of Medicine, and Godspeed with this application cycle, because we're all going to need that extra support.
That's right.
Thank you both so much.
Okay, thank you.